the COVID-19 cases are now steadily rising again in Ohio. For example, after reaching a low of 17.6 on July 7th, our 2-week average of cases per 100,000 have more than doubled to 37.8, and our concurrent hospitalizations have jumped from 200 on July 9th to 348 July 20th. And yesterday, we reported an increase of 744 cases in just 24 hours. It appears that this surge is being driven by yet another variant, the Delta variant, which is, as I've shared before, even more contagious than the V117 or Alpha variant that preceded it. Indeed, looking at our most recent 2-week snapshot of genomic sequencing data, it would appear that as of July 3rd, the Delta variant was present in more than 36% of our detections. That's up from 15% in the first half of June and less than 1% in late July. And all indications are that our next 2-week data for the period from July 4th through July 17th will confirm that Delta is fast becoming the dominant variant in Ohio. In addition, we're seeing change in our age of people impacted by COVID-19, with a greater proportion of our cases and hospitalizations among the youngest Ohioans. For example, from October to December 2020, on average, only 12% of Ohio's COVID-19 cases occurred among people under the age of 20. But from May to June 2021, just a month or so ago, that figure jumped to 20%. Likewise, hospitalizations from those same time periods jumped from 2% to 5%. And The Lancet reported a very similar trend that was observed as Delta became dominant in the UK. The good news is that our vaccines continue to offer strong protection against the Delta variant, and that COVID-19 is now essentially a vaccine-preventable illness. And hundreds of millions of doses of COVID-19 vaccines have been administered to date. There's several key points I want to call to mind as we think about that large number of doses and the experience that is given us. More than 5.3 million Ohioans and 161 million people in the United States are now fully vaccinated. No corners were cut in the vaccine development process, but red tape was. Instead of months-long waiting periods between phases when paperwork could be prepared, the process moved. All the normal safety steps were taken in developing these vaccines, just like the vaccines that have protected us for years, like those preventing polio, measles, mumps, and whooping cough. Before vaccines, diseases like these were common and caused great suffering and deaths every year. Now, researchers have been studying mRNA vaccine technology for decades before the COVID-19 pandemic, and early stage clinical trials using mRNA vaccines had been carried out for influenza, Zika, rabies, and even cytomegalovirus or CMV. Additionally, because COVID-19 comes from a family of viruses, including the SARS coronavirus of 2002 and MERS from 2012, scientists had already researched how coronaviruses behave and had begun development of a vaccine for MERS using a modified spike protein. Those years of research laid the groundwork for the development of COVID-19 vaccines, vaccines which teach our bodies how to recognize COVID-19's spike protein and create antibodies against it. Now, those decades of groundwork were what allowed the vaccines to be rapidly developed, with the first vaccine trials in the US beginning with the Moderna vaccine in March 2020. That's 16 months ago. We know many Ohioans and others across the country are nevertheless hesitant to be vaccinated. It could be because they're concerned about side effects or don't know about the safety or efficacy of the vaccines. We see this hesitancy, we hear their concerns, and we understand. We want to do what we can to help answer questions, to help people get the facts for themselves and make the safest decision for themselves and their families. Today, COVID-19, as I noted, is really a vaccine preventable illness. Vaccines are our best protection against the virus. And Ohioans ages 12 and older can make the choice to receive that protection by getting the COVID-19 vaccine. For all Ohioans, the risk of being unvaccinated impacts not only themselves, but the people around them. Lower vaccination rates put children under 12 who don't yet have a COVID-19 vaccine authorized for their age group at real risk, as well as the small percentage of Ohioans who can't be vaccinated, or perhaps those with certain immune disorders. Of course, no medicine and no vaccine is without risks or side effects. Not everyone experiences side effects from this vaccine, and fortunately, side effects tend to be mild and short in duration. Possible side effects after receiving the vaccine include pain, redness, or swelling at the injection site. Throughout your body, you could experience tiredness, headache, muscle pain, chills, fever, or nausea. Not everyone experiences these side effects, but for those who do, it actually can be reassuring to know they're part of the body's natural immune response and can be an indication that your body is forming the protection that you need. We've also heard about and discussed some of the rare risks associated with COVID-19 vaccines. One such risk is myocarditis, inflammation of the heart muscle, which can reduce the heart's ability to pump and can cause rapid or abnormal heart rhythms. The CDC's Advisory Committee on Immunization Practices, known as ACIP, recently discussed myocarditis and data from the comprehensive vaccine safety monitoring systems in the United States. And they did so at length and in a very public forum. And they determined that while there does appear to be a very small risk of myocarditis after receiving a COVID-19 vaccine, the benefits of these COVID-19 vaccines far exceeds the risks. Today, I'm joined by two doctors who will help answer questions that we're hearing about any side effects and risks associated with the COVID-19 vaccines, as well as the benefits of being vaccinated. First, I'm joined by Dr. Patty Manning-Courtney, Chief of Staff and Professor of Pediatrics at Cincinnati's Children's Hospital. Dr. Manning-Courtney, Cincinnati Children's has been a part of the vaccine trials for the Pfizer vaccine. Can you tell me a little bit about what that entails and when those trials started?
Thanks, Dr. Vanderhoff. We've been very fortunate to be directly involved in the vaccine trials, which started in children actually last fall. Last November, we began recruiting 16 and 17-year-olds, followed by 12 to 15-year-olds, followed by children under 11 and is down to as young as 2 last spring. So we've had great experience firsthand seeing children participate in these trials. And we've learned a lot that children both benefit from these vaccines, they tolerate the vaccines. You know, the way that a vaccine trial works is that one group of individuals, children or adults, get the vaccine and another don't, they get a placebo. And then we watch both for side effects as well as for development of COVID. And we've seen through those trials that children are remarkably and wonderfully responsive to these vaccines. They're very well protected and they have had very minimal side effects.
Well, thank you. You know, I mentioned that all vaccines and medicines come with some risk of side effects. What are some of the side effects we've seen in children with the COVID-19 vaccines, and are they something that parents should be worried about?
It's a great question. And in general, children have had similar side effects as adults, but I would say even to a lesser degree than we've seen in adults. We see a little bit of, arm soreness. We see some headache and fatigue in some children, but it's been very well tolerated. And overall, the side effects from the COVID vaccine are far less serious, far less concerning than having COVID itself, even as a child. And so I would tell parents and caregivers that these are certainly not reasons to not pursue the vaccine, that children have tolerated this very, very well.
Well, thank you. Are there any other unique needs children and youth have when it comes to being vaccinated?
So we all know that kids can be a little bit more, have more trepidation around getting vaccinated about needles than adults. Although I would say, having seen many adults get vaccinated, I've seen a fair amount of trepidation from that group as well. And so, preparing a child for the fact that they're going to get a shot, but not overstating it, not demonstrating your own fear or anxiety about that, letting a child really model from you that it's going to be okay, it's going to be fine. Having kids be well rested and well hydrated before they come in for a vaccine is a good thing. It helps mitigate any kind of fainting or larger reaction. If a child's already stressed by being hungry or tired, that's not a great time to get a shot. But kids, they blow me away all the time. They do a great job. They are courageous and brave, and so many of them want to do their part to help end this pandemic.
Well, thank you so much, Dr. Manning Courtney. Also joining me today is Dr. Amy Edwards. Dr. Edwards is a physician in the Division of Pediatric Infectious Diseases and is an associate medical director for infection control at University Hospitals Rainbow Babies and Children Hospital. She's also assistant professor of pediatrics at Case Western in their School of Medicine. Thank you for joining us today, Dr. Edwards. Dr. Edwards, parents are, of course, concerned about the safety and well-being of their children. And the thought of a new vaccine really can seem intimidating. What message do you have for parents as they decide whether they should choose to protect their child from COVID-19 with a vaccine?
That's a really great question. And I think what I would say, and what I have been saying, because I've answered this question quite a lot up here in Cleveland already, is that yes, it's a new vaccine, but as you've already pointed out, vaccines aren't new. We've been doing vaccines for a very long time. And even though it sounds scary to say, oh, this is a new type of vaccine with this mRNA technology is not new. It's been around for ages. And there's really nothing different about the immune response to an mRNA vaccine than it is to any other vaccine, whether it's an adjuvant vaccine or a killed virus or a weakened virus vaccine. They all do the same thing, which is to activate those B cells and T cells to make us immune to future infection. And so in that sense, it's really not new. It's very old. Furthermore, what I point out is just the sheer number of people that have been vaccinated, not just here in the United States, but around the world. If you look at the number of people who have been vaccinated, particularly with Pfizer, but also with Moderna, it's in the hundreds and hundreds of millions, and the safety record is phenomenal up until this point. And so there's no reason to think that kids aren't different in that respect. So they should respond to the vaccine just the same way everybody else does. And so I don't see any reason, not to have a child vaccinated.
Well, thanks for that. We've heard a lot about myocarditis, which is a very real but very rare risk. What could you tell parents about concerns regarding this risk?
That's another really great question. And it is something that we have to kind of address head on. So myocarditis, as you've already mentioned, is inflammation of the heart muscle. And it does appear that there is a slight risk that somebody who's been vaccinated, particularly males who have been vaccinated against COVID with one of the mRNA vaccines, could develop this inflammation. It seems to be more likely after the second shot. It's usually in that first week right after the second shot. However, it is, as you pointed out, a rare side effect. And in fact, it's so rare, we're actually not even quite sure just how rare it is. Somewhere in the range of about 1 per 100,000, maybe 1 per 200,000 is about where it looks like it's settling out to be. If you compare that to the risk of myocarditis from other things, because the vaccine's not the only thing that can cause myocarditis, right? Viruses like Coxsackie virus, influenza can do it, and actually COVID-19 can do it. If you look at the risk overall, or the rate of myocarditis in the general population, it's about 23 per 100,000. So you can see that it's actually a higher risk from viruses than it is from the vaccine. Furthermore, if you look at kids and COVID, everybody thinks, oh, kids don't get COVID. But if you look at kids' heart in COVID, we know that the rate of myocarditis or of any kind of heart damage with COVID is actually pretty high. It's probably in the 1% to 2% range. So if you compare that to the risk of myocarditis from the vaccine, there's really no there's no comparison. The risk is much higher from the virus itself. The other thing we know about myocarditis from the vaccine is it seems to be very, very mild, both out of the US and out of Israel. There have been some pretty big studies done. It's like 95% of the cases are mild. By the times of the study release, nearly all of them had already resolved. So I think on balance, it's very clear that the risk from the vaccine is much, much lower than the risk from the virus itself.
Thank you. You know, you've treated children with multi-system inflammatory syndrome, MISC, and we've talked a good deal about MISC in some of our press conferences. Could you comment on which is worse, the risk of getting COVID-19 or the potential side effects or risk from these vaccines with MISC in mind?
Sure, that's a really great question. And I have treated kids with MIS-C, and I will tell you, it's scary. I will never forget our first patients that rolled in last spring with MIS-C, and just this overwhelming feeling of, I have no idea what I'm doing. But you know, it's become very clear that most kids with MIS-C are very, very sick. The majority of them end up in the ICU. Many of them end up on breathing machines. And in order to treat them, to save them, we have to treat them with just massively high doses of steroids and massive high doses of immune suppressive drugs to get the inflammation under control, you know, to get the kids healthy again. And we have no idea what the long-term complications of that might be. And if you look at the rates of MIS-C in kids, again, we're talking somewhere in the about 0.5% to 1%, about 1% of kids who get COVID will go on to have MIS-C. You know, that's a huge amount of children. I know it doesn't sound like a lot. 1% is a very small number, but when you're talking about healthy kids running around and then boom, they're in the ICU on a ventilator, it's scary. And so for sure, no doubt about it, the risks from the vaccine are way exceeded by the risks of MIS-C, for sure.
Dr. Edwards, if parents have questions, where would you advise that they turn to get answers?
Oh, that's easy. See your pediatrician. You know, your pediatrician knows your kid, knows your kid's health, knows their medical history, knows your family medical history, and they will absolutely be able to help you answer questions and understand, you know, what the right choice for your family is.
And what about those who are 11 or younger and can't be vaccinated? What can we do as Ohioans to protect them?
What we can do is we can get vaccinated and we can wear our masks. What we know about the vaccine is not only does it protect me as a vaccinated individual, but it also protects everybody that I come in contact with. So, and furthermore, we also know that the vast majority of pediatric cases are from adult exposures. While kids can spread COVID child to child, that's less common than adult to child transmission. So if all the adults in a child's life are vaccinated, then that child's risk of acquiring COVID is exceedingly low. So while our youngest kids can't get vaccinated, it's incumbent on all of us to get vaccinated to protect them.
Thank you so much, Dr. Edwards. Well, with the school year right around the corner, I want to remind parents and guardians that it can take 5 to 6 weeks to be fully vaccinated once you make that decision. For youth who are eligible for the Pfizer vaccine, for example, it takes 5 weeks. The first dose, followed by their second dose 3 weeks later, and then full protection being reached about 2 weeks after that. Now, we know it can be difficult to schedule a vaccine appointment with family activities like summer vacations, sports practices, games, etc. However, COVID-19 vaccines can be administered concurrently with other back-to-school immunizations. And we encourage parents to talk to their child's pediatrician or family doctor about any questions or concerns they may have. We also know that there have been questions about the American Academy of Pediatrics recommendations regarding schools that was released this week. Now, it's fairly clear that the AAP was building on earlier guidance issued by the CDC and responding to remaining concerns parents and schools have voiced as they prepare for a safe and successful new school year. Now, while children are less likely than adults to get severely ill from COVID-19, as we've shared today, they're not invulnerable. And the pandemic has taken a real toll on children. Children get sick from COVID-19. They spread it to others. And some, as we've discussed, suffer some severe health outcomes. Let's remember the hundreds of Ohio children who have suffered long and debilitating hospitalizations with MIS-C. And I think Dr. Edwards did a very good job of describing that condition. The American Academy of Pediatrics recognized that while vaccination is our best protection against COVID-19, many K through 12 students simply can't receive a vaccine yet. And some communities have low vaccination uptake, and we continue to face more contagious variants. The AAP balanced all of this with research and experience from states like Ohio, showing that even before student vaccination was even an option, schools could safely remain open with masking and other safety measures in place. Now, the AAP has offered one set of practical recommendations based on research and past experience aimed at minimizing the potential threat of COVID-19 in our schools. The Ohio Department of Health is carefully considering the new guidance from the AAP in light of the earlier guidance from the CDC, as well as input from various stakeholders. And we anticipate offering recommendations for the new school year soon. Now, I want to reiterate that COVID-19 isn't gone. We need to remain vigilant, and the best protection we have is the vaccine. The more Ohioans who choose to be vaccinated, the better. According to the CDC, preliminary data from several states over the past few months strongly suggests that the vast majority of COVID-19 cases in the United States are occurring among unvaccinated people. And the risks of COVID-19 are clearly worse than the risks associated with the vaccines. We encourage all Ohioans to talk to their doctor and get the facts. Alicia, I think we can take questions now.
Thank you, Dr. Vanderhoff. Our first question comes from Chelsea Sick with WKEF.
Thanks for taking my question. So why doesn't the state, so I'm going to start over here. Why doesn't the state track breakthrough COVID-19 cases unless someone is hospitalized or dies from the virus? And since the state isn't tracking that, how do we know the efficacy of the vaccine?
Yeah, so again, I've answered this question before. First, we are following along with the approach taken by the CDC in terms of vaccine breakthrough. We have to understand that this is a type of virus called a mucosal virus, not unlike influenza, for which vaccines do a very, very good job of reducing the severity of illness that you may experience, particularly of keeping you out of the hospital or preventing death. There can be some rate at which people develop mild to moderate illness with really effective vaccines against mucosal viruses. The good news is, and it's proving to be the case with this virus, the vaccines typically reduce the viral load, the amount of virus that's in your body, low enough that even if you do develop some symptoms, usually you're also not very contagious. So the issue of breakthrough with this kind of vaccine against this kind of virus is really the issue of, are you seeing people get severely ill? Are they ending up in the hospital? Are they dying? And we're just not seeing that in appreciable numbers with this vaccine. That's different than if we're looking at a virus that involves the bloodstream, so-called viremia, in its normal life pattern, such as measles, where with those viruses, vaccines really can put essentially a bubble around you so that the virus bounces right off you. So that's part of the reason that the breakthroughs are defined the way they are. In terms of how we know about efficacy, well, it's trial after trial after trial where we've been able to, through scientific study, look and see, hey, how well are these vaccines working? And I've shared previously links to many of those trials, but we have a large number of them.
Our next question comes from Dan DeRose with WOIO.
Well, good morning, everyone. First of all, congratulations to ODH for having the forethought to use Dr. Amy Edwards. She has been an incredible resource for us here in Cleveland. Dr. Bruce Vanderhoff, we've gotten to know you now for quite a few months. You're not maybe one for real tough talk. You are based in facts. But at what point do you have to reach out to the 52% of people who aren't vaccinated in Ohio that have had months of opportunity and really hit them over the head with, hey, you either get it or you're going to get sick. It is your option, and it is extremely possible with how contagious the Delta variant is that we're seeing the numbers increase. And if you can address that too, this has been a pretty significant increase over the last week, seeing more than double our 21-day average.
Well, thank you. I think that's actually a very good and very accurate message. What we now know with the advent of the Delta variant is that you only have two choices left. Either you get vaccinated or you are going to get COVID-19. And so really, I think what people need to do is balance which gives you the safest, the best path forward. Is it the best path to get the vaccine or the best path to roll the dice and get COVID-19? I think as doctors, what we're saying is the choice to us is very clear. Your best choice, your safest choice is to get vaccinated because COVID-19 is a nasty virus. I'll turn to my colleagues, Dr. Manning Courtney or Dr. Edwards, to see if you'd like to add anything. Dr. Manning Courtney, maybe I'll start with you.
I would add that in addition to having that choice between a vaccine or COVID-19, I would also say that the way that you're going to protect the children in your life that you love, your nieces, your nephews, your children, your grandchildren, your cousins, your neighbors, whoever you are, I suspect you have a relationship with a child who's under 12. And the way that you're going to protect them is to vaccinate yourself. It is such an important choice to make as a member of society. And what I love about pediatrics is that we often do more for our children than we do for ourselves. We take better care of our children than we do ourselves. Well, this is a way to take care of the children in your life, is to vaccinate yourself.
Thank you. Thank you. Dr. Edwards?
Oh, I am 100% with that. I have a 2-year-old and a 4-year-old. You have to vaccinate the adults to keep the kids safe. And if you look, you can look at other states to see where we're headed. You look at Mississippi, they've got a record number of kids in the ICU. You look at Arkansas, their pediatric hospitalizations are going up. Ohio, we do not want to follow in their footsteps. We do not want to fill our pediatric ICUs up with COVID or MIS-C cases. And the way to do that is very clear, just like everybody's already said, get your vaccine, keep the kids safe.
Thank you, doctors. Our next question is from Adrienne Robbins with NBC4.
Hi, thank you so much for doing this today. I would like to get your reaction about two comments that President Biden has recently made. One, he said that the misinformation we're seeing on social media is killing people. Do you think that's true, that at this point in the pandemic, misinformation is killing people? And he also said that we're in a point where we're seeing a pandemic of the unvaccinated. Is that what
I hate to give you my very best bite.
Yeah, no, thank you so much. I think it is absolutely the case that we are now looking at a pandemic of the unvaccinated. That's been evident in other countries. It's now increasingly clear here in the United States. It's a good news, bad news story. The good news is the vaccines work very well. In fact, the vaccines are very effectively protecting people who've received them from really getting sick. If you look, though, at the people who are getting sick with COVID-19, across the country, the lion's share of those people are unvaccinated. So very accurate statement regarding that. In terms of information, unfortunately, I think there have been people who are sharing information in a very authoritative way that is not scientifically accurate. And as a physician, that's very distressing because we want people to make their own decisions, of course. We want people to, be the captains of the ship of their own health. But we want them to make their decisions on the basis of good, well-founded scientific information. And frankly, it's heartbreaking when we see people who are cascading information that is not scientifically based. Again, I'll turn to my colleagues to see what you might add.
I'll start by sharing that as a developmental pediatrician who's worked with families of children with autism and children with autism directly for over 20 years, I have experienced this space of vaccine misinformation and the harm that it does. And minimally, it puts parents and caregivers in a really tough spot of having to make a decision between, it's really a false choice, but a decision between vaccinating their children and worrying about the effects of that vaccine or not, and then worrying about the disease. And so to me, this is an extension of something I've experienced for a long time. And it frankly, it breaks my heart because I see how families and parents wrestle with this decision. And it's unfair that they've been put in the position to have to even consider misinformation in their decision-making. As Dr. Vanderhoff said, what we can do is we can provide the best information, the best science for people to make the most informed decisions. And if we have platforms that propagate misinformation, they make that job so hard. And at the greatest extent, if somebody chooses not to get vaccinated and they get COVID and they die, that was preventable because we have vaccines.
Yeah, I would agree with that 100%. And I would just say that, vaccine misinformation has been harming children for decades. As an infectious disease doctor, I have watched a child die of whooping cough here in the United States. That's unacceptable to me. I mean, it just should never happen. But the parents of that child had fallen prey to vaccine misinformation. They were afraid that the vaccine would harm their children, so they didn't vaccinate their older children. Their older children developed whooping cough, spread that to the baby, and the baby died. A completely preventable illness. And now we're seeing that on steroids. Vaccine misinformation has been there for decades, but we're really seeing it just spread rampantly across social media and all over the place. And sometimes I'm almost shocked by what people are claiming that the vaccine is capable of doing. But people don't know. Not everybody is a scientist. Not everybody's a cellular biologist. Not everybody understands how mRNA works or, how the immune system works. And so, as you said, some of these people are speaking very authoritatively. And so it's very easy to fall prey because parents want to do what's best for their kid. And if they hear that the vaccine can harm their child, oh my goodness, they're not going to do that. But that's, and that's why we have to just constantly spread the message that information is wrong. The vaccines are very, very, very safe. And that, it's really a good idea to get vaccinated.
Thank you so much, Dr. Edwards. Our next question is from Joe Ingalls with Ohio Public Radio and Television.
Hello, thank you for doing this. I want to ask about the real chance that kids can get this. What I hear frequently from parents of young children is that they don't think that this is as big of a deal as what some make it out to be. And they think babies are immune. And they also, if you go in any store, go to a Sunday school, go to wherever, an indoor kind of place, you see massive numbers of kids, young kids under 12, running around without masks. So what is the real life implication of this? Are kids really getting sick from this in large numbers, or are we still just seeing smaller numbers? Can you kind of give us a depth of where this is at this point?
Well, thanks. I'm going to let my colleagues who are pediatricians actually begin, and then maybe I'll add some comments at the end. Dr. Edwards, would you like to start?
Sure. I hear this a lot, first of all. Oh, kids are immune, kids aren't affected. What I say again and again is the only reason that what's happening to our children doesn't make the news is because it is worse in adults. But COVID absolutely affects kids. If you look at the numbers, like the hospitalization rates, school absenteeism from being sick with COVID, and even the mortality rate from COVID in children, it's about as bad as our worst flu season. So if you think about our worst pediatric flu seasons that make the news and all these kids are sick with the flu, that's basically what COVID is. But it doesn't stop when flu season stops. It's been going all year. And yeah, the numbers seem small, but that's because kids are healthy. Kids aren't supposed to be getting sick. And so for kids, these are actually huge numbers. And again, it's the only reason it's not making the news is because it's so dwarfed by how badly affected adults are, which is fine. I got to say, I thank every God that may or may not exist every day that COVID isn't as bad in kids as it is in adults. But kids are not immune. Kids are not immune. They can get sick with COVID. And that is why it is so important to keep masking, especially if you're indoors and in contact with other people who aren't vaccinated. And it is so important for all the adults to get vaccinated to protect those kids.
Dr. Mann, would you add anything to that?
Just add, fully support what Dr. Edwards shared, that kids are not immune. We've had over 350 children hospitalized in the past year, including babies, including right now, babies hospitalized with COVID. We've had over 12,000 children positive for COVID who were not hospitalized. We're not sick enough to be hospitalized, but some of those have had long COVID effects. We get questions about ongoing symptoms on a regular basis and have had to think about standing up clinics and programs for those children who have the chronic effects of COVID. The only other thing I would add is that I feel, truthfully, we are one variant away from this being worse for kids. And is that what we're going to do? We're going to wait until it is worse for kids, and then we might take it seriously and get vaccinated. It's going to take one variant, and those variants swirl and they get created in the unvaccinated population where COVID is continuing. And that's what it'll be. We'll learn the hard way, I'm afraid, that COVID can actually be even worse for kids than it already is, because a variant will come along that will be worse for kids.
Yes, thank you. And I think what I would add is that not only have we had many children in the hospital, not only have we seen hundreds of cases of MIS-C right here in Ohio, but if you look at the death toll from this, remembering that, the death of a child is particularly tragic. It is, the death is the loss of a life at the beginning of that life. And so historically, we've always responded very vigorously anytime we've had an opportunity to save the lives of children. Compare the somewhere in the neighborhood of 400 official deaths recorded among children from this virus. As Dr. Edwards said, that compares very favorably to a really bad flu season. And look at that, though, compared to measles. When before vaccination, measles was killing in the neighborhood of 500 children a year. What parent would hesitate to vaccinate their child against measles today? Most would not hesitate to do so because they recognize measles is a bad disease. Well, you know what? COVID-19 is a bad disease too.
Thank you very much. Our next question comes from Susan Kratzer with Hannah News.
Hi, I was just wondering, do you think, given how rigorously the vaccines have been studied, that the FDA could address some of this vaccine hesitancy or skepticism by giving full approval? And do you think that they're potentially sending any kind of mixed messages to the public by not?
Well, I think that there are many, many factors, and we've addressed a number of them today that feed into vaccine hesitancy, especially for parents. But I have heard parents indicate that they would feel much more confident if the FDA went to the final step of granting regular approval for the vaccine. So I can certainly say that I would like to see them take that step. Certainly, as we look at the volume of data that is available for these vaccines, I think medically it is a very appropriate and defensible step for them to take. I'll turn to my colleagues to see if they have anything they'd like to add.
I think it would help. It would instill confidence, but I also think that the FDA is taking it very seriously, this decision. And so I think it kind of goes both ways. It can instill confidence because the decision's been very well thought out and carefully considered, and all these side effects that come under consideration are being addressed. But I can see where it would give, people who are going to be hesitant are going to look for sometimes additional reasons to be hesitant, and this could be one. But I'm very much looking forward to the day that we have full approval.
Yeah, but the other thing to remember is, one, they've already I know Pfizer and Moderna have both applied for full approval, but it's an enormous amount of paperwork and red tape. And the FDA has said again and again that they are not going to cut any of that red tape or paperwork back. So it's a huge undertaking to get full approval for a vaccine. So even though they've begun the application process, most of us don't think that it's going to get approval till sometime early to midwinter, not because we need more data, but just because that's how long it takes. I mean, that's just the process that we and here in the United States have built into our vaccine approval process. And the process has to work itself out. So I hope that while I do understand parents wanting to wait for full FDA approval, the FDA has all the data they need to make that approval. Now it's just a matter of paperwork and red tape and ticking all of those boxes, which just takes time.
Our next question is from Pete Grieve with Spectrum.
Hey, good morning. Dr. Vanderhoff, I heard you use the word recommendations as far as the new guidance about mitigation protocols and masks for schools. Some states are requiring masking in schools, at least for unvaccinated students. And I guess both for you and the doctors, why not require masking for unvaccinated students in schools?
Well, I would say that as the Department of Health, it's our role to evaluate the information and offer people the best guidance and recommendations that we can. So that will be the approach we'll be taking. Obviously, it will fall to the schools themselves and other entities to examine that information and make that decision.
Our next question is from Anna Huntsman with IdeaStream Public Media.
Hi there. So we've been talking a lot about, vaccine hesitancy, but, also there's a large group of children who can't get vaccinated. So I'm curious what your message is to parents who are vaccine hesitant for themselves. Are they causing harm to their kids who can't get vaccinated if they choose not to? What's the risk here?
So I'll begin. I think I'll turn to my colleagues again. They're pediatricians, and I'll let them begin.
I would be very hesitant to ever make a parent feel that they're doing harm when they're trying to wade through a lot of information and make the right decision for themselves, their family, and their child. Having said that, I think that if we could convince parents who are hesitant that not only does it protect them, and protecting themselves as a parent protects their family. We talk a lot about, we use the analogy a lot in pediatrics about, you have to take care of yourself first as a parent. You have to pull the oxygen down for yourself first on an airplane before you so that you can take care of your child. Getting a vaccine is similar, but it does two things. It protects you from getting COVID and getting sick and not being available to your family to care for them, but it also protects you from transmitting COVID to your child who can't be protected. And so it's a very fine line to walk, right? I don't want any parent to feel guilty about their choices. I really don't. Parents have so much that they have to weigh all the time. But I want them to seek information and be informed and partner with them on making good choices.
Yeah, I agree 100%. I don't think the word harm is a very useful one, because parents will just shut down if you kind of attack them like that. So I would frame it much more positively. The single best thing they can do to protect their child right now, especially with the spread of Delta variant, is to get vaccinated themselves. You know, when you make that more positive framing, I think that really helps parents understand, you know, what they're doing for their children, by giving that messaging that that's how they can protect their child the best.
Our next question is from Gabriela Garcia with WBNS 10 TV.
Good morning. Thanks so much for doing this. By the way, you mentioned earlier the spike in cases we're seeing, and just for clarity's sake, I have a few questions there. So why is that spike happening? Because it's pretty huge in comparison, as you mentioned. Were you guys expecting this kind of spike? Will this kind of rise in cases continue, and what could that mean for schools and small businesses, et cetera?
Well, thank you. Unfortunately, we were anticipating that as we headed into the summer, it was likely that we were going to see another rise in cases, largely driven by the Delta variant. Watching how this variant has impacted other countries, and then as it came to the United States, impacted other states, really painted a picture for us that it has led us to be expecting essentially what we're seeing here. And where will this go? Well, I think that we can anticipate that over the coming months, people who have not yet been infected with COVID-19, people who have not received a vaccine, are almost certainly going to be infected with COVID-19 due to the Delta variant and its level of infectiousness. So it is really now just a matter of time. It is when, not if, an unvaccinated individual develops COVID-19. And as we've looked at how the Delta variant has behaved, it has moved through the unvaccinated populations of countries. And so I think it's a time when we're redoubling our efforts to encourage people in Ohio to take advantage of this wonderful option that we have, which is protection with the vaccines. It's excellent protection. It is safe protection. It's certainly a much better option than running the risk of getting COVID-19. Dr. Edwards or Dr. Manning Courtney, additional thoughts?
I would just say I agree completely. This was not unexpected. I personally have been sounding the alarm for months, watching what's been happening in other states. As you said, we knew this was coming. But the other thing is, I just want to remind people, back in spring and early summer of 2020, as COVID was first taking off and we first started to understand what it was we were grappling with, we were all hoping for a vaccine. I remember when the first Moderna trial opened, oh gosh, what was it, May or something of 2020, and how worried we were that it would fail and how hopeful we were that it would succeed. And it did succeed beyond our wildest imaginations. We were hoping for 60% efficacy, maybe 70% efficacy. We got 95% efficacy. You couldn't ask for better than that. And not only that, but it turns out that these mRNA vaccines are incredibly versatile and appear to be protecting us against multiple variants and mutations of the spike protein. If I had told you back in May of 2020 that that's how well these vaccines would work, you would have made fun of me for being too optimistic. We have the best thing we could have hoped for, and we are lucky enough and wealthy enough that we have enough doses for every single member of our society. Not every country can say that. So let's take advantage of it, and just everybody needs to get vaccinated, and we could literally move on to talking about something else.
Thank you. Our next question is from Jackie Borchert with The Inquirer. Jackie?
Good morning. Thanks for making the time. Much of this call was about the importance of vaccinations. What about people who are fully vaccinated? Should they be changing their behavior at this point? The numbers themselves aren't very high comparatively, but are increasing or doubling even very quickly. At what point should the vaccinated population or the general population be changing their behavior or taking extra precautions?
Well, the good news is that it does appear that our vaccines remain very effective against this Delta variant. Clearly, we all need to, be thoughtful about what we're doing and how we're doing it and where we're doing it. But right now, I think that people who are vaccinated are very unlikely to develop a significant illness from COVID-19. That's most people. Now, I mean, are there going to be exceptions? Of course, there could be people who have impaired immunity of some kind or did not have a great response to the virus. But the data show that the vast majority of people who receive this vaccine are well protected. And interestingly, the data also show that while they may develop some mild symptoms of COVID if they're exposed, it doesn't look like they're very contagious. It looks like they don't spread the virus very well to other people. So right now, I think it's a good news story regarding vaccination. Our main concern, at least my main concern, is about the portion of the population. If you look at 18 plus, it's roughly 40% of the population that have not yet chosen to be vaccinated. I worry a lot about them. I don't know if my colleagues have additional thoughts.
No, I think you covered it pretty well. That says it all.
Thank you, doctors. Our next question is from Justin Dennis with Mahoning Matters.
Hey, doctors, thanks for taking our questions today. I'm curious, in your advisory role at ODH, if you recommended requiring masks in Ohio schools to either Governor DeWine or Director McLeod. The governor and ODH director exercised their mandate powers last year to protect children with the school shutdown. Can we expect anything similar this year if Delta begins spreading in schools and gets out of control?
Yeah, I'm not able to comment on policy decisions, but what I can tell you is that we're actively looking at this, as I described, looking very thoughtfully at recent guidance that came from the American Academy of Pediatrics now just 48 hours ago, input from various stakeholders, and the guidance that came from the CDC now maybe a couple of weeks back. So I think you can look for guidance and recommendations to come from us in the near future.
Thank you, Dr. Vanderhoff. Our next question is from Brian Hamrick with WLWT. Brian, I believe you are muted. I apologize.
I'm sorry, still working on my phone. So I appreciate you taking our questions. And I may have missed some of this earlier on. I was interested in some overall hospitalization numbers. What are the hospitalization numbers looking like? And another question, and I wanted to see if somebody might answer. We are now in an era where we don't have these protections for the unvaccinated, like masking, like social distancing. And we add to that, we're gathering in concerts, we're at restaurants, we're all together in these different places. On top of that, we have the Delta variant. Is there a formula to know how much more the odds are that someone has of catching this virus that they didn't have even a few months ago? I think a lot of people have a two-step program. One, I'm not going to get the virus. And then two, when I do, my odds of getting sick aren't very good. Is there a formula? Is there some sort of, are there numbers where this is measurable that you could try and relate to people of how their odds are changing with this Delta variant?
Well, I think the best answer that I can give to that is that as we look at this virus, the variants that emerge and replace the dominant variant that preceded them have consistently been considerably more infectious than the preceding variant. Now, anytime you have something that's more infectious, obviously, it infects more people. The other thing is that typically these are more infectious because it just takes less of the virus to get you sick. And when you roll that all together, not only does that mean that more people get it, but more people, because more people have it, end up being significantly ill. And that's what we're seeing. We're seeing that here with the Delta variant. So, you know, it's infectious enough that my colleagues and I this morning have said repeatedly, look, it's now a choice between vaccination or running the risks of COVID-19 infection, because you're going to get it. We are recommending as a far better, far safer option, going ahead and getting vaccine, knowing that there's also a side benefit that by getting vaccinated, you're also providing some level of protection for the people you care about who maybe can't get vaccinated right now, including some of your younger children. So there are just increasing reasons to go ahead and think about the vaccine now. In terms of what we're seeing numbers-wise, I did share at the beginning that we are seeing increases in cases that are fairly remarkable. We've had a doubling just in about 2 weeks. But while we are seeing increases in hospitalizations, we're not seeing the same pace of increase of hospitalizations. And why is that? Well, fortunately, when we look at the population 18 and older in Ohio, almost 60% of them are vaccinated. And we look at 65 and older, it's more than 80% are vaccinated. So what I would say is that vaccination is working. And I would encourage people to get into the group that is protected through vaccines, because that seems the safest option. So Dr. Edwards, Dr. Manning, Courtney, what have I missed?
Nothing. I just want to say what you said again. You will get sick from COVID. This Delta variant is contagious. And if you look even in states and countries where the vaccination rate's in the 70% and plus, this variant is so contagious that it's finding all those little pockets of tiny unvaccinated groups and it's making them sick. And we have much larger pockets than some of those other places. So there's no doubt about it. Now that the Delta variant is here, you will get sick from COVID. So take this opportunity before it's gotten too bad to get vaccinated to protect yourself.
Thank you. Our next question comes from Jamila Mohammed with Spectrum News.
Hi, guys. Thank you so much for taking all of our questions. Can you guys hear me?
Okay, yes, great. Yes, can hear you
great.
well.
So my question is, you guys have addressed the Delta variant a lot throughout this press conference, and we've seen as schools are starting to get back into in-person learning that there is conversations around masks. Do you guys see us as a society going back to wearing masks, whether you're vaccinated or unvaccinated, especially with this new Delta variant?
Well, as I shared earlier, we do have a variety of inputs, guidance, on the one hand from the CDC, on the other hand from the American Academy of Pediatrics, specifically looking at the issue of schools. But you know, and we at the Department of Health are examining all of this and do anticipate offering guidance for the state in the near future. However, the school environment is a unique one. It's a special one because the majority of the students that we're looking at in the K through 12 age bracket don't have access to a vaccine right now. It's a different story when we look at adults because we've got this great tool. we can all go out and get the vaccine. And thankfully, many of us have gotten the vaccine. And at the end of the day, and I know I'm repeating myself, but it's an important thing to repeat. It really comes down to, are you vaccinated and safe, or are you unvaccinated and vulnerable? Are you unvaccinated and soon to get COVID-19? Again, doctors, anything that you would add to those comments?
The only thing I would add is that, this COVID has taught us a lot about the efficacy of masking. And so I personally don't see a scenario where we go back to universal masking, although anything could happen. I do see scenarios where we recognize sometimes in healthcare settings, not just the benefit against COVID, but against other respiratory diseases. Dr. Edwards and I both experienced dramatically declined numbers of children being sick with other things besides COVID, and things that can be very devastating to their health, whether it's RSV or other types of respiratory viruses. So I'm grateful that we've learned so much about the efficacy of masking, and I think it's here to stay in terms of being an ongoing tool for us in keeping people safe.
Yeah, I agree 100% with that. It was fantastic, actually. In Cleveland, we were 100% RSV free. We didn't have a single hospital admission for RSV last year. And I believe we didn't have an admission for influenza either in the entire pediatric hospital, which was just astounding. And I'd love to see that repeated every winter. And I've talked to a lot of parents who have really enjoyed not having their kid out of daycare so much, not themselves having to stay home with viral illnesses because their kids are bringing home less crud. And so I agree. I think that masking is here to stay in some form. I will also, volunteer the information that I am a fellow of the American Academy of Pediatrics. I know they just put out a statement 2 days ago that I am personally in agreement with, but I think that masking in some form or fashion, especially with our kids, is here to stay. I hope it is, at least.
Thank you, doctors. Our final question comes from Sydney Canty with WFMJ 21 News.
Hi, yes, my question is, well, there are like a lot of younger parents, like people my age, like in their 20s, and I have heard them say things like, I'm not putting that poison into my body or into my kids' bodies, and like these are actual quotes that I've heard from them, referring to the vaccine, and they feel that way about a lot of other vaccines as well. So I know that we have probably reiterated this many, many times, but I'm really seeing a lot of the lowest vaccinated like numbers in some areas in the people like my age group. And so I'm wondering, like, what would you say to those young adults who are sometimes very hard to communicate anything to? And then also, let's say that we are able to get the cases back down again like they were recently. Do you all expect them to rise again when holiday seasons come around, or when next summer comes? Like I say, when Christmas comes, when Thanksgiving comes, and then the summer 2022. Like, are you expecting them to rise with every big occasion? And if that is the case, would it get worse with each surge?
Well, I'll start by addressing your second question and then turn to my colleagues because of their pediatric experience to talk about your first very good question. So, I think that one of the lessons that we can take from watching this virus is that it has progressively gotten more and more infectious. It has continued to evolve in a direction of being able to get at more people. But it has been stopped by the vaccine. So that portion of the population that's vaccinated, it's not able to impact that group. It's not able to spread within that group. And I think our hope is that enough Ohioans will choose to get vaccinated that we can avoid another winter surge. This is a winter virus. And it should be somewhat alarming to people that in the dead of summer, it's still able to spread in the way that we're seeing it spread right now. Frankly, I think that the spread we're seeing now would be worse if this were December. So the fact that we're having this kind of spread with a respiratory virus in the middle of summer tells you how important it is to protect our population as much as we can by building immunity with the vaccine. So that's kind of my thought at that level. But I think you're asking an incredibly important question about confidence. in the safety of what parents are deciding to put into their children's bodies. And of course, a parent needs to think about that. That is the wonderful gift of parents, right? That they put their child first. And I'm going to turn to my pediatric colleagues who address those kinds of concerns every day to see what they think.
So you're right, Dr. Vanderhoff. I have addressed vaccine hesitancy, I feel like every day of my career, starting with my work in with families of children with autism and the extreme vaccine hesitancy that they had around the concern that vaccines caused autism. So here's what I said back then, and I would say a version of that today. I said, I never saw a child whose autism was caused by a vaccine. Never saw it, never saw autism get worse. I have seen children with autism who were never vaccinated. And similarly, I would say to families, I've never seen a child damaged from a COVID vaccine. I have seen children significantly damaged by COVID. And I think that those single messages of what you've seen or who you know, those carry more weight often with families and parents than large. I've had this multi-site trial, with numbers and stats, which we tend to want to do sometimes in academic medicine. But to say, I have a patient who had COVID, and this is how sick they got. I have no patients who got the COVID vaccine and had a negative consequence from that. That's just how that's what I've seen in my space. And I just want to help them make the safest decision.
Yeah, and I would add to that the one technique that I know a lot of pediatricians use and that I use myself when I come in contact with vaccine hesitant people is to listen to their concerns. I've heard the term poison as well. I'm not injecting that poison into myself or my kids. I've absolutely heard that. And my question to the parents is, what is it about it that you're afraid is going to poison your child? And just really let them get their fears out, because, parents, this burden of parenthood is we're terrified most of the time, right? That we're going to do something wrong or that we're going to harm our child or, oh my goodness, am I doing the right thing here or there? And when pediatricians are quick to dismiss it and just say, oh, it's not poison, go get your vaccine, that's not very helpful, right? So what we really need to do, and what I've always encouraged my pediatric colleagues to do, is to just really listen and understand what the parent's concern is. Because usually if you can get them to state out, oh, I heard that it could do this, or I heard that it could do that. And then you can show them that it doesn't do that and that information that they had heard was incorrect. That really helps take a weight off their shoulders and helps them feel more comfortable with taking that next step. So I think it's really incumbent on us in the medical community to listen to our patients. And that's why I would encourage people who aren't sure about the vaccine to reach out to your doctor and have that conversation with them.
That was our final question. Doctors, thank you for joining us today. Dr. Vanderhoff, I'll pass it over to you if you have any closing remarks you'd like to share.
No, I just want to thank everyone for joining us again here today. Thank you for your wonderful efforts at sharing some of the information and messages that we've offered today about the importance of vaccine, the safety of vaccine, and thanks again.
Thank you all for